Our current goal is to move from 15% of surgeries in charter facilities to 30% over the next couple of years. So we are trying to double the number of surgeries that are performed in chartered surgical facilities. We have always had surgeries performed in those facilities that are publicly insured, but this is one way of getting more surgeries done more efficiently and more quickly to reduce surgical wait times. It's more important now than ever because of the post-COVID the increase in surgical wait times as a result of interruption from COVID pressure in the hospitals. Saskatchewan very successfully piloted a similar program starting about 8 years ago, and they saw that the chartered surgical facilities were able to perform surgeries at lower cost because of more efficient use of capital. Basically, they're using those surgical suites that are privately owned, in some cases 24/7. That is not typically the case in government hospitals. They also have more flexible labor arrangements, and as private operators, they are more focused on cost control. And so one thing important to underscore is that 100% of the surgeries that will be funded through this initiative are publicly insured. No one has to get out their credit card, not for one dime. This is all publicly insured, but it's the best way we can start to get on top of these ridiculous surgical wait times that we frankly inherited from the last government and that have gotten worse during COVID. The healthcare system in Alberta and in Canada is largely delivered by private businesses. Every doctor, when you walk into their clinic, is a private personal corporation. Every surgeon who bills to us, whether it's in a hospital or outside of a hospital, operates as a private contractor, as a private corporation. So the vast majority of services provided by by private operators within public administration. I don't think people care whether the doctor is paid a salary or is operating as a professional corporation. They just want the service done, and we want to get it done as efficiently as we can. But there are some deeper issues here that we will be addressing in the weeks to come. You know, in 2019, according to the Canadian Institute of Health Information, Alberta had the lowest per capita number of intensive care beds of all Canadian provinces, even though we have the second highest per capita health expenditures in the country. That makes no sense. That's the situation we inherited and went into COVID with, which is a very expensive system with results that don't justify what we're spending. And so the broader strategy to increase health capacity, yes, will involve some more money, but also finding smarter ways of delivering things like other provinces do. Why is it that other provinces that spend less on healthcare are able to field more beds, particularly for intensive care? That's a serious question we need to answer as a province, and we will be addressing all of that in the weeks to come.
We'll take two.